Good afternoon, everyone. Thank you for joining the ninth annual SIEGE Symposium. My name is Dr. White, and I'll be moderating this session, Use of Screening Tools to Advance Environmental and Climate Justice 1. Today, I am introducing Dr. Chakraborty and Grace T. Lewis. Dr. Chakraborty is a professor of sociology and anthropology at the University of Texas at El Paso. He is also the founding director of the Socio Environmental and Geospatial Analysis Lab. And we also have Grace Lewis, Senior Health Specialist of the Environmental Defense Fund. Um, I'm not sure who would like to present first, but you are all able to share your screen and share your slides.
Dr. Chakraborty, if you'd like to go first, you're welcome.
Okay, I'll do that. Let me start by sharing my screen. Okay, are you able to see my screen? All right. Okay, so hi everyone, and thank you so much for coming here today and to this session. I would like to first thank Kobe Wilson and other organizers of this symposium for inviting me here to speak in this session. And in the last few years, I've been involved in reviewing and providing recommendations for several environmental and climate justice screening tools. I've served on multiple committees and related review panels for the EPA and the White House Justice 40 initiative. And most of my recommendations and related presentations have focused on methodological issues and technical aspects of these, environmental justice screening tools. And in today's presentation, I thought I would try something different and focus on a limitation that has received, I think, significantly less attention: the absence of people with disabilities, and also how these screening tools can be used to incorporate and analyze disability justice. Now, given that disability is somewhat of an understudied category in climate justice or environmental justice research and policy, I thought I will begin with some background. Now, disability or people with disabilities kind of represent a rapidly expanding or growing group in the US, with almost 25% of adults reporting some type of disability, according to the CDC. At the same time, disability is a somewhat complex and multidimensional concept that can be defined, studied, or understood in multiple ways, using many different approaches or frameworks, theoretical and conceptual, which is my focus here today. The definition I'm using here is based on the US Census or ACS definition of disability, which has been around since 2008 and also used now by most federal agencies. And this is based on 6 types of difficulties as shown on this slide. And the universe includes institutionalized civilians only. So it does not include residents of group homes, mainly because the disability accommodation needs of people living in group housing are supposed to be addressed by the facilities or institutions in which they reside. And people with disabilities also represent a highly disadvantaged group in terms of health status. They have been defined, for example, as an unrecognized health disparity population based on several well-known health indicators. Is particularly important here is self-rated health status. And also, a recent CDC study found significant disparities between the disabled and non-disabled people in terms of obesity, heart disease, and other negative health outcomes. And disabled individuals also report lower rates of healthcare access, which has been linked to the rising cost of healthcare in the US. Now, beyond these health disparities, people with disabilities also represent a highly disadvantaged category in terms of socioeconomic status. A recent report from 2021 found huge disparities in employment, earnings, and poverty rates between the disabled and non-disabled. And these gaps have not really decreased over time, as these two line graphs on the right indicate, at least in the last 10 or 12 years. And compared to non-disabled people, the disabled are also significantly more likely to die or be critically injured during climate disasters, such as hurricanes, floods, and now heat waves, and suffer many other negative impacts from slow onset climate change also. But despite this significantly higher vulnerability to hazards, disasters, risks, and climate change, disability remains a kind of an under-examined topic in EJ research and scholarship. And in my own way, I have tried to address this gap in my own recent research, but all of my published studies have found disabled individuals to be unequally exposed to or adversely impacted by many different hazards and disasters. And looking beyond academic research, disability also remains largely or has remained largely excluded from environmental justice definitions and policy documents. Now, this federal definition of EJ, which was originally authored by the EPA, and I think has been around since the 1990s, and now used by several other federal agencies, including the CDC. So this specifically mentions race, color, national origin, and income, does not include disability status. However, the good news here is that, this is coming from President Biden's new executive order on EJ, which was announced on April 21st, just a few months ago. And if you look at this definition, or the first sentence on the right, you will notice that disability has finally been officially included in the federal definition of environmental justice. And this, I think, is a very important first step, but a lot more needs to be done in terms of incorporating disability status more explicitly in EJ decisions, policies, research, as well as mapping and screening tools, which is the focus of our session here today. So I thought for this talk, I will focus mainly on answering these two questions that are based on well-known, national scale screening tools. First, are disabled people adequately included or represented in these three widely used screening tools? The EPA's EJ Screen, the White House CEQ's CGEST, and the CDC's EJI Explorer. Now, each of these screening tools use different approaches to define EJ communities or vulnerable places that are overburdened by pollution and other hazards. So my second question seeks to examine whether people with disabilities and specific types of disability are statistically overrepresented in areas with greater EJ concern, as defined by each of these screening tools, compared to the non-disabled population. Now, in terms of my data, variables, and definitions, here are the six types of difficulty I mentioned earlier, used by the ACS or in the ACS questionnaire to measure disability. And important to keep in mind that these difficulties often overlap. These are definitely not mutually exclusive categories. In fact, most individuals above the age of 75 years tend to report at least 3 of these difficulty types. And my analysis is based on census tract level data from the latest or 2021 ACS for the lower 48 states or contiguous US. And according to the latest ACS data, about 41 million people, or 12.6% of the national total for contiguous US, reported at least one type of difficulty, with ambulatory difficulty the most common or prevalent category nationally or in the contiguous US. So my analysis of these two questions began with the EPA's widely used EJ Screen tool. And so I'll provide a quick overview of this tool first. In EJ Screen, socio-demographic factors are used to define or derive 2 different indexes, one of which is the main demographic index and the other is a supplemental demographic index. But none of them contain any disability indicators or disability-related variables. They focus primarily on non-white and socioeconomic status. Now, each demographic index can be linked or combined with 13 different environmental indicators, which are shown on the slide. And this combination of the main demographic index with each of these 13 environmental hazard indicators leads to 13 different EJ indexes. And in terms of how they're combined, for each block group or census tract, the environmental indicator percentile is multiplied by the demographic index to produce what is known as the EJ screen EJ index. And these EJ index values can be used to identify areas where higher pollution burdens coincide spatially with social vulnerability. Now, EJ Screen does not define EJ communities or attempt to define EJ communities, but their technical documentation does mention areas for further review or areas that might need more consideration, analysis, or outreach. And as you can see from the highlighted text on this slide, these areas are defined as census block groups or tracts where any one of the 13 EJ indexes are at or above the 80th percentile or in the top 20% of areas nationally. So this was my starting point for measuring overrepresentation of people with disabilities. And here are the initial results for areas that need further review as defined by the EJ Screen tool. Now, EJ Screen allows users to download both census tract and block group level data. I use only the tract level values for consistency because ACS disability variables are published only at the tract level. And to measure overrepresentation, I use risk ratios that divide the national share of people in each disability category by the corresponding share of people without disabilities, which means that a risk ratio higher than 1 would imply overrepresentation and lower than 1 would be underrepresentation. And if you look at the first two rows, the percentage of people with a disability or two or more disability types, they exceed the percentage of people with no disability. So this ratios are greater than 1, and it's significantly greater than 1 also based on a few tests I conducted. When I examine the type of disability or difficulty reported in the ACS form, all these categories are overrepresented in areas that need further review based on EJ Screen's definition, except for those with hearing difficulty, the only risk ratio that was smaller than 1. And I also wanted to look beyond the areas with at least one EJ concern, or the EJ Screen's basic definition, and examine if this overrepresentation of disabled individuals changes with the number of EJ indexes that exceed the 80th percentile threshold, for a given tract. Now, with the sole exception of hearing difficulty, again, all disability categories are underrepresented in areas where exactly 0 or none of the EJ indexes exceed the threshold nationally. Essentially, these are tracts that do not need further review as defined by EJ Screen. But as the number of EJ indexes out of 13 that exceed this 80th percentile threshold goes up, as the number of EJ concerns increase, risk ratios tend to increase for all disability categories, except, again, for hearing difficulty. Now, the percentages for overall disability and all categories, except hearing difficulty, indicate the highest risk ratios or greatest overrepresentation, again, compared to people with no disability, in areas where all 13 EJ indexes exceed the 80th percentile threshold. Almost all these risk ratios in the rightmost column are greater than 1.3. So if these are the most overburdened tracts nationally with the highest number of EJ concerns, as many as 13, then these are very disturbing results for people with disabilities. Okay, so my next step was to conduct similar analysis using the CEQ's CGS tool. Now, with a little bit of background again, this tool comes from the Executive Order 14008, which led the White House CEQ to develop a geospatial tool to identify disadvantaged communities that face climate-related and economic burdens. And version 1.0 of CGS, which was launched in November of last year, uses national data sets to identify disadvantaged census tracts that face 8 different types of burdens that are listed in the first column of this table, from climate change to workforce development. And the second column, which may be hard to read here, includes many different environmental, climate, health, and economic indicators that are used to define or measure these 8 burden categories, as well as the percentile thresholds for each individual indicator. Now, what's not included here in this column is race or ethnicity, a very important limitation that has been discussed before by many other EJ advocates and scholars, including Sekovi Wilson, who is part of this session. But I was thinking, what about disability? There are no disability indicators or variables on this entire list. So obviously, disability status is also not considered currently by this tool. And according to the tool, tracks are classified or defined as disadvantaged if they meet the CGIST criteria or threshold for at least one of the 8 burden categories or are located within tribal lands. And based on this definition, people with disabilities and all disability types were found to be highly overrepresented in tracks defined as disadvantaged by this tool. You'll notice that all risk ratios, including hearing difficulty, here are higher than at least 1.1. But like I did with EJ Screen, I wanted to dig a little deeper beyond this simple definition of disadvantage or tracks facing at least one burden. And here is a table that indicates how the overrepresentation of disability proportions change with the number of burden categories for which CGIST thresholds are exceeded. And I found that disability groups are highly underrepresented in areas where exactly 0 or none of the 8 burden thresholds are exceeded. So, using CGIST definition, these can be classified as non-disadvantaged communities, I guess, or something like that. But as the number of burdens out of 8 that exceed the CGIST threshold goes up, as the number of burdens increase, 1 to 3, 4 to 6, 7 to 8, risk ratios tend to increase for all disability categories, except for one minor exception, again, with hearing difficulty. But the overall disability percentage in almost all categories except one show the greatest overrepresentation compared to people with no disability in areas facing 7 or 8 burdens. So again, these are the most overburdened or disadvantaged areas as defined by the tool. But in this column, all risk ratios are, almost all of them are greater than 1.5, tracks with 7 or 8 burdens. And finally, I repeated this same analysis using the CDC's EJI Explorer. And what makes the EJI a little bit different from EJ Screen or the CGIST tools is that it examines environmental burdens using a health-based perspective or health equity-based approach. And EJ scores here are based on percentile rankings, and it includes 36 different indicators that are grouped into 10 domains and classified into 3 modules that focus respectively on social vulnerability, environmental burden, and health vulnerability. Now, a civilian with a disability from the ACS is included here as a household, as part of the household characteristics domain, and is part of the social vulnerability module. However, the type of difficulty or disability is not considered. Now, the EJI technical documentation does not define a specific cutoff or threshold percentile for defining EJ communities or areas of greatest concern or something like that. But there is, I found one sentence that mentions tracks in the top 20% or above the 80th percentile of EJI scores nationally as areas of potential concern. And I use this cutoff also because it matches the EJ Screen threshold for identifying areas that need further review. Now, based on this table, I found people with disabilities and all disability types are highly overrepresented within tracks in the top 20% of the overall EJI score. You'll notice that all risk ratios, including hearing difficulty, exceed 1.1, and most of them are even greater than 1.5. And I also wanted to separately examine the modules that comprise the overall EJI. I did not use, however, the social vulnerability module because, as I mentioned, it does include civilians with a disability as one of the indicators. So I wanted to avoid potential double counting because higher social vulnerability is driven to some extent by the disability, overall disability percentage. In terms of the environmental module, people with disabilities and all disability types except hearing difficulty are, again, highly overrepresented within tracks in the top 20% for the environmental burden EJI score. And when I turned to health vulnerability, I found that people with disabilities and all disability types, including hearing difficulty, they show even greater overrepresentation within tracks in the top 20% for the health vulnerability EJI score. You will notice that in this column, all risk ratios exceed 1.4, and 3 of them are even higher than 1.7 for vision difficulty, ambulatory difficulty, and independent living. Now, given that these areas are in the top 20% nationally for negative health outcomes such as cancer, diabetes, mental health, these results are very, very disturbing and suggest that disability status does coincide with higher health vulnerability in these tracks also. So again, I started out by asking these two questions. The first of which focus on representation of disability in environmental and climate justice screening tools, national scale screening tools. And the second question focused on overrepresentation of disabled people in areas with greater EJ concern as defined by these three screening tools. In terms of the first question, both the EJ screen and CGS currently do not include any indicators of disability status or disability characteristics. The CDC EJI, however, does include civilians with disability in one of the domains that comprise the social vulnerability module. However, it does not make a distinction between different types of difficulty or disability, treating the disabled almost as a single or homogeneous category, which can be problematic and definitely a limitation that needs to be addressed in the future. For my second question, both EJ Screen and CGS provided similar results with minor exceptions. People with a disability and in almost all disability categories are more likely to live in areas with the highest EJ concern or the most overburdened communities as defined by each of these tools. And also, as the number of EJ concerns or the number of burdens or level of disadvantage increases, the extent of overrepresentation of disabled people with respect to the non-disabled also increases quite substantially. And the CDC EGI does not have a clearly defined threshold, but disabled people are overrepresented in areas that are ranked in the top 20% of the overall EGI score nationally. And again, extent of this representation is particularly higher in tracks that are ranked in the top 80th percentile for health vulnerability, which suggests that disability status can intersect with poor health status. And on top of that, you have the existing local, environmental, and socioeconomic burdens to create kind of a multiple jeopardy for people with disabilities nationally. And all these disparities and results really highlight the need to do more, include disability status in future research and scholarship on, as well as policies and interventions and decisions related to climate and environmental justice. And as I mentioned before, expanding the federal definition of EJ to include disability is an important first step. But I strongly feel that environmental and climate justice screening tools can provide an excellent platform or excellent starting point for implementing this expanded definition and addressing the larger goals of this new executive order. And I think that concludes my presentation. Well, thank you so much for listening and watching. Hope I didn't take up too much time.
Thank you so much for your presentation. We also have Dr. Wilson. He joined a couple of minutes late, but he is the director of the Community Engagement, Environmental Justice, and Health Siege Center at the School of Public Health, University of Maryland. So I'm not sure if Dr. Wilson or if Ms. Grace Lewis wants to present next.
You want to go, Grace?
Sure, I'm happy to go. Okay. All right, let me put it into presentation mode. Sorry, I'm trying to get it going right. Okay, there we go. Can you see my slides? Okay. So thank you for having me today, and for Dr. Wilson for inviting me to speak. And I am going to be talking today about the Climate Vulnerability Index, which is a tool that we have recently developed at the Environmental Defense Fund. And I'll just briefly show you our equity and environmental justice vision for our organization and acknowledge the contribution of our community stakeholders in helping us to develop this tool, as well as our Texas A&M collaborators to create the Climate Vulnerability Index. And I think important to the development of this tool is to recognize that a majority of environmental justice screening and mapping tools do not involve the collaboration of community leaders in developing their instruments, their tools, that is. And we have purposely, from the beginning of the conceptual idea of the Climate Vulnerability Index, purposely engaged a group of community stakeholders, both in Texas, Illinois, New York, Michigan, we have been working with in the past to lend their voices and to make this tool useful for their advocacy, but also to directly reflect their lived experience. And so I will begin by saying something I think that many people who are on this right now on this workshop know, that persistent environmental injustices and health disparities experienced by EJ communities are not accidental, and rather they are linked to these longstanding policies and racial discrimination that have resulted in disproportionate burdens, and that we are beginning to see the emerging picture that this is in fact perpetuating itself in climate inequity as well, and injustice. And so we in the past had developed a regional screening tool for our Houston, Galveston, Brazoria region called the HGB EnviroScreen, which we had presented here at this symposium. And so this is the next iteration of this, of an environmental justice screening and mapping tool, which we have developed for the entire United States. And it is called the Climate Vulnerability Index, or CVI. And we really developed this tool on a national scale for all census tracts across the United States, in order to understand where are the most vulnerable communities cumulatively, that is, in the United States, and what is driving that inequity or that vulnerability in their community, with the idea that there are his unprecedented opportunity with Justice 40 to try to drive benefits to improve these inequities for these communities. And so we hope that this data-driven GIS tool is going to help make this data actionable, empower those communities and in their advocacy, in developing action plans, but also to assist policymakers, decision makers, people who are providing the funding to communities to try to make informed decisions that are based in data and science. And so we have taken a lot of guidance. We used the WEJAC recommendations, a lot of different efforts by other screening tools, but also, as I said, listening to community voices. And so we made a very concerted effort to try to include and take a very holistic approach to understanding that vulnerability and community resilience are rooted in all the social determinants of health, and that we needed to take a holistic approach to understanding how to make communities more resilient to climate, environment, and health. And so we wanted to look at the intersection of those factors. And so we created this tool, and it is probably the most largest number of indicators compared to all the screening and mapping tools that I know of. And it contains 184 indicators. We certainly assessed even more than that, but this is what's available on a national scale. So while there might have been indicators that were representative for a local scale, these are available for all census tracts in all 50 states plus the District of Columbia. You can see on the left-hand side kind of the approach we took in creating our Climate Vulnerability Index, and that we used EPA's Toxicologic Prioritization Index, much like we did before with HGB EnviroScreen, but we had to modify it to incorporate this many indicators. Our smallest geographic scale is the census tract, but our index score can be visualized both at the county and the state level. And you can see here that we we had equal weighting of all indicators within a particular category and then across categories. Most of this data is cross-sectional. It's based on annual data, a majority of it from 2017 to 2019, because we wanted to avoid some of those pandemic-related anomalies in the data, but also some of the 2020 data and above were not really available, even though we do have some that is 2020 and beyond, and we just use a crosswalk to make sure that they were all the same geographic resolution, which was the 2010 census tract boundaries. So we created this unitless index score for all the census tracts in the US, and we are able to then use GIS to visualize that score and help us to both communicate, but also dig into what is driving those disparities. And so here you can see that we created two main themes: baseline vulnerabilities, and those are those factors that are really contributing to a community's ability to be resilient. So you see there's 4 different domains: health, socioeconomic, infrastructure, and environment. And then the majority of these are, as I said, they're historical cross-sectional data. And then we have the climate change risks. We have those 3 categories, and these are the direct and indirect impacts on climate change. And we have both some historical data, but a lot of these are projections of data. And I am very briefly going to just show you what's included in these so that I can get to you some examples of actually what is included and how we can use our tool to help communities try to achieve some changes in their community. So you can see here, this is baseline health, and within a particular domain or category of, we have these subdomains and subcategories. And we have purposely included things like that the community had wanted, things like ADHD, childhood asthma, and things like access to care, as well as some chronic disease indicators. The baseline social and economic, a lot of this comes from the Social Vulnerability Index, but we have taken apart and used each indicator as their own, as their own indicator. But the community also wanted to make sure that we had representation of particularly vulnerable communities, such as veterans populations, the homeless, single parent households. We do have things like redlining and hate crimes included in this, as well as gun violence estimates and the number of religious and civic organizations, because we recognize that those are a really important factor in helping communities maintain resilience. Infrastructure is one of the, I think our tool is one of the few available that includes infrastructure indicators. And we recognize that this is really important because all of these infrastructure elements have a profound impact on communities, as we know that years of disinvestment and disenfranchisement have really put communities back and made it more difficult for them, and that a lot of our community-based organizations are living in food deserts, have a digital divide that is real because of lack of the communication infrastructure and the like. Our baseline environment is the most populous one of our different domains, and you can see here all of these indicators ranging from area and transportation sources to criteria pollutants and really important land use variables like green infrastructure. These are our 3 climate change related domains, and you can see here what's included in extreme weather events. The socioeconomic, which includes like the cost of climate disasters, in addition to projections in flood risks and wildfire risks to properties, and some of the social stressors that are implicated as well. And our health impacts of climate change, which is the least most populated. There's a lot of effort that needs to go into this particular area where we need to have more robust climate impact health projection data. And so here is a quick visualization of the overall CVI score for the United States. And one thing to note is that here in the Southeast, this is where we have the highest ranking census tracts, but there is no state in the United States and all 50 states in the District of Columbia that is not impacted by climate change and climate risks. We can also visualize our CVI score just by those 4 baseline categories combined. And you can see here there are definitely, and here the lighter the color, the darker, the lighter the color, the higher the score. But you can see that similarly here in the Southeast of the United States, we have some of our highest baseline categories. And we can visualize this also for those 3 climate change categories. And that's a quick summary of our spatial distribution in where we see the highest ranking scores. And this is also on the right-hand side, a visualization. You can look at the CVI score for each of the different domains. And just to kind of pull this out to help you to visualize it better, I made the top 5% highest ranking census tracts in orange here. And again, you'll see the concentration here along the South and Southeast. And we also compared to the CGEST, their initial one, and you can see that the blue are the CGEST identified census tracts, and there is a lot of consistency, and I have put some dots for our top 100 out of 73,000 plus census tracts, and the majority of those top 100 census tracts are concentrated in these 4 states alone. But you can see that there is a really good consistency between what we identify in our CVI tool and what other tools which have also put together the intersection of climate, environment, and health have also identified. But because we are able to include so many more variables, there is a difference in the tracts that we identified because we're able to include race and other indicators in our tool. So I'm going to give you a really quick sneak peek because our tool is going to launch on October 2nd, the dashboard that is. We're really, really excited about that. And so I'm going to just give you a quick example of how you can use the CVI. And so, for instance, I have this example of Ferndale versus Highland Park, Michigan. And you can see on the left the demographic profile for Ferndale versus the demographic profile for Highland Park. And you can quickly see those differences in income, in education, in race, as well as poverty levels. And you can see this spatially, they're different, and Ferndale here being in the very white versus the darker color. So in our tool, everything that is darker is higher ranking. And this is a breakdown of their overall CVI score. And you can see that Highland Park ranks 31st out of all the 2,800 census tracts plus in Michigan, whereas Ferndale is ranking towards the bottom. And you can see, again, these color differences that are visualized immediately, and then we'll just dig in a little bit more. And so, for instance, among the baseline scores, infrastructure really stands out for the Highland Park community as being an important contributor to why their community is vulnerable and disadvantaged. And so you can see here that communications, they rank in the 99th percentile in the top of the United States and governance and energy costs. And in particular, that a quarter of these low-income households have an energy burden that's 5 times higher than the median energy burden. And this is one of the highest in the country, as you can tell by its percentile ranking. Similarly, we can see that the socioeconomic stressors being experienced by Highland Park, unemployment, income, for instance, that these play a particular role in the community's ability to sustain high energy bills and avoid some of the other threats to their community, such as housing, foreclosures, and the like. And so when we have a higher risk, for instance, of storms, both summer and winter storms that threaten power in Detroit, for instance, that really gets magnified in communities like Highland Park, which are going to be particularly susceptible. And then the potential impact on the grid reliability exists for them. Again, if you remember, infrastructure was one of their highly ranking sources of vulnerability. And so how can we link that then to the different Justice 40 initiatives? And so here are a couple of programs that could be taken advantage of, recognizing the particular vulnerabilities with regard to energy, but as well as trying to connect them to different grant programs to prioritize jobs, education, et cetera, to try to shore up those deficits that we see and that can be using the CVI to really showcase how disadvantaged and how they compare to other communities, both within their state and across the United States, as well as by EPA region. Here's just a copy of like our paper, and I'm happy to answer any questions that you might have. Oops, let me stop sharing my screen.
Okay, looks like I'm up next. I'm trying to share my slides. Let me see. Hold on a second. Sorry, y'all. Looks like I'm gonna have to do this differently. Please let me know we can see them. Hit escape. Hold on a second. Share screen. Oh, give me a quick second. Uh-oh, I am not. Okay, is that it? Okay, here's one. Okay. Can y'all see that? Anyone?
Yeah, we see it.
Okay, cool. Thank you. So I'm just gonna give a. So I'm Shakobi again, professor, University of Maryland, College Park, direct siege, as was mentioned before, am one of the experts as Grace and JR. And when it comes to these screening tools, so I really appreciate being on this panel with my colleagues who've been doing a lot of the leading work on these screening tools. So I just want to talk quickly about some of our work in building screening tools in the state of Maryland. I want to highlight a few tools that we built. Don't have some of the calculations in this presentation that Jay shared, and looking at some of the correlations, et cetera. But I think what's important about these tools, we have as was mentioned by Reverend Barber, and as mentioned by Mustafa, and just in general from EJ Advocates, Jay mentioned, there's been a lot of interest, as Grace mentioned, a lot of interest in these screening tools. And so in our state, we've started working on screening tools, I think in 2015, 2016, building Maryland EJ Screen. And my team has built a series of screening tools, or working on a series of screening tools that I'll try to highlight again a few. The classic tool is Maryland EJ Screen. We also have a park equity mapping tool that I'm not going to talk about because I don't have enough time to in this presentation. We also have a climate equity health mapper, so I'm going to show a few slides on that, and also a Mid-Atlantic EJ mapper that I'll show a few slides on that as well. So when you think about these screening tools, many of them, while we need to have them because a lot of communities, as Grace mentioned, they want to have tools to help visualize local community concerns. I think one of the issues that we've discussed, and I think Jay, maybe Jay, you talked about this in your introduction. We have a screening tools work group that's part of US EPA EJ Screen tool work group that's part of the Science Advisory Board. And so there's been a lot of discussions about US EPA EJ Screen. There's also a work group, National Academy of Sciences work group on the CEGES tool. That's the tool that both Jay and Grace mentioned, Council Environmental Quality's Climate and Economic Justice Screening Tool. So it's important to have these screening tools to help visualize environmental justice concerns or environmental justice burden. Our screening tool, in many ways, builds off of the EPA screening tool, EPA EJ screen, and also builds off of Cal Enviro Screen, which is the oldest state level tool. As I've like to say, when I get a chance to be on the soapbox, I believe every state should have its own screening tools. It's important to have national tools that are innovative and robust, like the new tool that's been launched by Grace's team. It's also important to have regional tools and also state level tools, because again, EJ is really place-based in my opinion. You're talking about spatial justice. So having tools that can do work at the national level and state level, and Grace mentioned before their regional tool they have in Houston, more regional levels, so you have some interoperability between those tools. I just wanted to share that. But our tool, Maryland EJ Screening Tool, uses the approach, the scoring approach that California uses with pollution burden times population characteristics equals the score. And so we have a similar approach. In this presentation, I'm really talking about Maryland EJ Screen 2.0. We're going to have a more in-depth discussion of Maryland EJ Screen 3.0, I think on both Friday and Saturday in a series of workshops that are related to our TIC-TAC work. So just wanted to share that with the attendees. And just for TIC-TAC, that's the EPA's program, Thriving Communities Technical Assistance Centers. I am the co-director of the Region 3 TIC-TAC with Dr. Adrian Hollis, who's at the National Wildlife Federation. The National Wildlife Federation is the parent on the TIC-TAC. And so as part of our TIC-TAC services, we'll be doing a lot of training and technical assistance on EJ issues. And one set of things that we'll be doing is providing services for folks to be able to use various screening tools, including our tools, state level tools, but also some of the national tools like CDC EJ Index that was mentioned previously, CEGES tool, and also US EPA EJ Screen as part of the service that we provide. But getting back to our tool, here are some of the layers in the version 2.0 tool. We have a version 3.0 that we're working on, and again, we'll have a presentation on that later on this week. We have some of the classic categories when you have exposure, environmental effects, sensitive populations, and socioeconomic characteristics. And so here's just a list quickly of some of the indicators that we have in the pollution burden exposure domain. And you see that we have, again, some of the typical ones that you'll find in other national tools and also state level tools. We have environmental effects, which get at some of the proximity issues. If you think about one of the classic concerns when we look at environmental injustice is proximity of communities of concern to one or more hazards of concern. So looking at distance to a particular type of operation. And this classically, when we talk about burden, a lot of times when we talk about like actual burden, we're talking about using type of distance measurement to look at closest operation or a host, non-host approach. Do you host a facility in a block group, some unit of analysis? If you host a facility in a census tract, or use some type of buffer analysis to look at capturing a zone of impact, a zone of influence around in a community when it comes to capturing operations of concern. So you have, this is the environmental effects category. You have sensitive populations, so that's the classic framing. I'll talk more as I get to the latter part of this this part of the presentation about our revised tool and how we've kind of innovated and expanded our domains. But since the population is getting at some of the more of the health factors, so we think about health burden. If you want to keep with the term burden, looking at health burden and looking at populations who may be more susceptible, they're more sensitive. And then you have socioeconomic factors. So you think about environmental justice. To me, you can't have environmental injustice without the differential burden and differential sort of the burden issues as relates to the hazards, that burden category, and these population characteristics. So you have to bring in some type of socioeconomic characteristics, whether it be you're looking at percent people based on class, a percentage population based on race, and as Dr. Bordy mentioned, the CQ tool does not include race. Colin Viral Screen also does not include race. But I think one of the gaps in the tools is making sure that we can capture the phenomenal racism, and how do we do that better in our tools. And so this is just a screenshot that shows some of our tools. As I said, we have multiple tools, and this screenshot shows the Park Equity Mapper, which I'm not having slides today on that tool, but there's a lot of overlap between the types of domains and the types of indicators that are in our screening tools. And so we have a percentile ranking score. Some folks don't like using the term score, but I think for making sure that we have a term that's usable, I like to use the term score. But if you're in the 91st percentile, that means you're ranked higher than 91% of the state. So these screen tools are really a ranking process. And Jay, I think both Jay and Grace mentioned the idea of cumulative impacts. So how are we able to use these screening tools to look at the cumulative impacts of the burden of multiple chemical and non-chemical stressors, multiple hazards, whether it be environmental hazards or even social hazards. And as Grace mentioned, I believe these tools are very important when it comes to policy. I think as it relates to Justice 40, there's a really important opportunity to use these tools to track, identify and prioritize and micro-targeting communities with most need. One of the things that we've addressed in our revised version, or trying to address in our updated version of our tool, is making sure that we capture more rural areas, more unincorporated areas. That's been a critique of many of the screening tools. And of course, that's been one of the important points of conversation when it comes to our discussion as part of the Science Advisory Board discussions around screening tools. How do we make sure we're better at capturing rural areas? And in this slide, we're talking about unincorporated areas. So areas of a community that may not be incorporated. They don't have a town mayor. They don't have a town council. In southern areas, particularly where my area of work, they tend to be areas that end up being targets for hazards, or they also may be areas that may not have a lot of investment. Getting back to Grace's point about infrastructure. In many cases, unincorporated communities don't have access to publicly regulated sewer and water infrastructure, which are really big issues. And I think they're basic environmental justice issues. I think it's also important to make sure that as we move forward with our tools, and as Grace talked about in her presentation, and then Jay did as well, there's some overlap and interoperability between the tools. So I think that's a point that we need to get to, where we can have sort of a fit for purpose approach, where we have these national tools, but when it gets down to look at final resolution, when you're trying to address things at a different scale, it's going to be important to maybe shift or switch to a state level tool, because a state level tool may have layers that it may not be found at a national level tool, because in many cases with national level tools, we want to find data indicators that are nationally representative. But again, EJ is local. So it may be inappropriate in some cases to exclude a particular indicator because it's not a national representative, but in a region or a state, it may be a very important issue. So for example, CAFOs, Confined Agricultural Feeding Operations, is one to highlight in states like Maryland, also states like North Carolina. We're looking at industrial hog farms and other parts of the country that may have a state level issue that may be really important, but nationally, the data set may be incomplete. And so in some cases with tools, we may exclude those data sets. For example, in rural areas that may have a lot of extraction, having more data on energy indicators or energy infrastructure may be more useful in those areas from a state level and a regional level. But in some places, if that is not really an issue, then you may exclude that particular indicator. So legislative wise, we've done a lot in the state of Maryland to work on using mapping tools like EJ Screen in our state policy. This is this example of a legislation of a bill where we've tried to bring in the use of the tool to help us with defining overburdened and underserved communities in the state of Maryland. We've used the tool for multiple bills in bill language, including the Climate Solutions Now Act. So we basically use the tool to help define, pulling out indicators, help defining areas that were overburdened and areas that are underserved in the Climate Solutions Now Act, and other legislation from 2022, and bills that we try to pass in 2023. So this is just an example of the ways that you can do that. So you can have a screening tool that gives you a score. You can also be able to use the screening tool to just visualize these types of indicators if you want to try to see which ones are the most important above a certain threshold. In this case, we want to look at above the 75th percentile for median household income, and looking at these environmental indicators. And as Grace mentioned, you also want to bring in issues like infrastructure as well. So percent broadband coverage. So from a policy perspective, you could use the score, the composite score. You can use a domain score, right? Or you can pull out the indicators for a legislative process and find ways to do like a matrix approach. You want to see if they're above a certain threshold for income, above a certain threshold for race, ethnicity, above a certain threshold for environmental issues. You can also have a separate approach above a certain threshold for health burden as well. That's not included on this slide, but that's again another way we can use screening tools and visualization as it relates to the legislative process. Let me skip this slide. We also have done some work just trying to figure out how you could, again, identify and prioritize in different states in the Mid-Atlantic region. And, and here you see how we use 3 or more of the EJ indicators, again, those more environmental indicators and that infrastructure indicator above the 75th percentile, and residents who are identified to be below 200% the federal income poverty index, federal income level, poverty level. So again, you could have a screening tool and then again, pull out certain indicators and be able to visualize what areas you want to prioritize and micro target when it comes to intervention. So it could be Justice for federal investment benefits, or it could be other state level investments, maybe the state revolving fund. There's major issues in Delaware, again, when it comes to sewer and water infrastructure. And then again, this is another slide where we use a different set of indicators, and what we don't include mining locations or unincorporated areas. So you see the change in the map from the previous slide to this slide when you include mining locations in unincorporated areas. Let me move forward, so I'm running low on time. So additionally, we working with the National Academy of Medicine, we helped them with their grand challenge on climate change. There'll be a presentation today, I believe, on that, or tomorrow, I believe tomorrow on that. And as part of that work, we created a national sort of mapping tool in some of the same way that Grace did to build out a climate justice index. And from that work, we leveraged that work to build out a Mid-Atlantic environmental justice screening tool. So the idea is we just didn't want to focus on having a screening tool for Maryland. We wanted to be able to capture what was happening, identifying, ranking, identify, prioritizing communities that have EJ burden across the Mid-Atlantic states. And so for me, the Mid-Atlantic states geographically include Maryland, DC, Virginia, Delaware, West Virginia, Pennsylvania, New Jersey, New York. Jurisdictionally, as it relates to a lot of our work, particularly the TIC-TAC, we would primarily focus on Region 3 of the EPA. So it'll be Maryland, DC, Virginia, West Virginia, Pennsylvania. Did I say Delaware? Delaware, Virginia, Maryland, DC. I mixed them up, but y'all get what I'm saying. So you have the geographic area and you have the more jurisdictional area. And so just real quickly, in this tool, we have different categories. We have a climate change domain, which is different than Maryland EJ screen. So we have a new climate change domain. We have environmental exposure, pollution burden, environmental effects. So environmental exposure and environmental effects, the typical categories. We also have a new health domain, where that's different than what you saw in Maryland EJ screen. And you see the list of indicators that we have as part of these various domains. So here's some of the indicators that we have in domains. You see climate related ones. Let me keep going. Socioeconomic related ones. We expanded from our previous set of indicators we used for Maryland EJ screen. And again, you see probably some overlap in what Grace showed in her presentation. Of course, you also see overlap as what you saw in Jay's presentation with bringing in disabilities. We have environmental exposures. We brought in some new data, some methane data in this, and we have environmental effects. And I think one thing that's a note for the audience, with the new Tempo satellite now, we may be able to get better air quality data. I believe one of the weaknesses in many of these screening tools is not having good air quality data. So using mobile monitoring is a way to address that weakness. Also satellite data. And because again, EJ is local, particularly if you have a more regional tool or maybe even more local city level tool, have some hyper local air quality monitoring data that can be used to kind of fill that air quality gap in the tools. And if you look at our scores, looking at tracks that are above the 75th percentile, we see the number of tracks above the 75th percentile. This is the composite score in Delaware, DC, Maryland, Pennsylvania, Virginia, and West Virginia. And so what you see here, you see a lot of these locations where 30% of the tracks in DC are above the 75th percentile. You see 46% in West Virginia, and we move to a 90th percentile. You see that in DC, 20% of the census tracts are above the 90th percentile. And so that as it relates to the Mid-Atlantic region, you see a lot of tracks that are above the 90th percentile in the DC area. So 44 out of 206. So if you think about, again, ranking tracks in each state and overall in the region, and then how do you prioritize and micro target from an intervention perspective, this is a good use of the tool. We see what's going on in these tracks. What communities do we need to engage? What goes along with doing environmental justice work is representative justice. So once you follow these tracks, who are the groups that are activated to do work? Or if you go back to the TIC-TAC, and we'll talk more about this again later in the week, this process will help us prioritize communities that we should provide technical assistance to, capacity building to, through the TIC-TAC, right? So this is another application for the tool. When you have grant funding like the TIC-TAC or any other technical assistance centers, whether it be transportation related out of the DOT or whether it be other federal agency related, you can use these types of tools to figure out what tracks, or even go down to a lower unit of analysis if you look at the block group level, what block groups should be prioritized for additional investments, additional engagement, additional action. I know we're running low on time. We do have another mapping tool that has some overlap with Grace's tool. And so this is our Maryland Climate and Health Equity Mapper. You see some of the domains that we have here. You see the scoring approach that we have, and we have 5 domains. And again, there's some similarities, some overlap to what Grace covered. So I won't, be too redundant because we don't have time. And this is just a few maps that we have just to show you our scores. And we have domain scores, we have composite score, and I'm going to move. I have way too many slides, so I'm just going to move to the end so we can get to questions. So again, these screening tools have multiple applications: education, support decision-making, and policy. So I believe from our presentations, you see, the need for these screening tools, the need to make sure they actually work well, and what gaps are in these tools, and why it's important to have national tools, interoperability, and make sure, again, we are, as Grace said, these tools are built to be responsive to the needs of those who are most impacted. They're ensuring that we achieve representative justice, but then with the actions to address the problems, we get to distributional justice and restorative justice. So thank you. Going to exit, I think. Go ahead, Dr. White.
Thank you. Thank you all for your presentations. We did have one question in the chat for Dr. Chakraborty. It says, could you discuss the reliability of ACS disability data given the high measures of error, a particular issue at the census block group level? Curious if you had any of those issues or concerns with the census tract data.
Yes, obviously that is always a concern, and especially because EJ Screen, I think, is only one of these tools that uses block group level data. And in the analysis I presented, I got around that by looking at the EJ Screen results or indicators at the census tract level. Now it's available for download, both census tract and block group level data. And I was trying to match it with the lowest or the finest resolution available for disability data. So that's why I ended up using census tract level and avoided using block group EJ screen data, which can be more problematic. But these problems exist. And I think what has happened as these tools are evolving, they are coming up with new ways to address both data uncertainty as well as missing data. Income and poverty data is not published for all tracts, census tracts nationally, right? I mean, obviously not for many block groups nationally as well. So, and I think one good example is how the CGS tool is addressing that by borrowing information from neighboring census tracts or adjacent census tracts, that are I think spatially adjacent to it, and using those to fill those gaps. And EJ Screen also has tried a similar approach in terms of looking at the blocks within a certain radius and borrowing data. But obviously, I think a lot of these screening tools do not actually provide that information simply by clicking on it, or they don't talk about the margins of error with the population estimates, and they should. I think that's I think Dr. Wilson, remember, one of the recommendations we are making for the EPA Science Advisory Board's review of the detailed review of the EJ Screen tool is to do a better job of communicating uncertainty and margins of errors. So even if it's within a certain range of the values that they provide, so we have a sense of how reliable those estimates are. And that's a work in progress. And the ACS itself is, I heard recently in one of the work groups I'm part of for the National Academy of Sciences, which is reviewing the CGS tool, and there are ways now of increasing the reliability of estimates, and but we need to see that's the next step, right, in terms of enhancing the accuracy of some of these tools where data is missing or less reliable, and especially for certain ethnic groups sometimes, and which also include which overlap with people with disabilities. So I think that's a major concern, not currently addressed by the tools, but hopefully they will in the future.
Thank you so much. I don't see any more questions in the chat. I'm not sure if our presenters have any additional comments.
I just wanted to say that we will share with you guys when our tool launches on October 2nd, and we will have as on our microsite and other accessibility to all of the data sets that are included, as well as to the GitHub, so you can go and download the raw data, etc. So I think data transparency is critical for many organizations to make sure that you can reproduce and try to dig into this, because I think, as Dr. Chakraborty was saying, there is inconsistencies sometimes, and so I think it's imperative that people feel comfortable with the quality of the data. We did use publicly available data sets as much as possible. So, and I will say also to Dr. Wilson's point that our tool will give you the ability for right now, that is, to only do point data, but you can overlay if you've got point data on our CVI tool. And so that's really important because, as Dr. Wilson was saying, local data is so much more meaningful and robust to communities. And even though we have a lot in our CVI tool, there is a lot that's not there because it wasn't available on a nationally representative scale. And so particularly for communities like in Hawaii and Alaska, where we had even more missing data, and you have tribal population, Native American populations that are particularly vulnerable, I think that is important to be able to understand and to augment the existing national data sets that are available.
I can definitely add to that. I'm not sure Jay wants to add. This is a very robust conversations we've had, Dr. Lewis, as part of the SAB meetings. The fact that with national representative, what does that really mean, right?
Right.
Hawaii, as you said, Hawaii and Alaska, Puerto Rico, some parts of the country not having the right data to really capture those experiences. And as you mentioned, rural communities and also indigenous populations, we have a whole, and Jay can chime in on this, a whole discussion across multiple work groups. I'm gonna use that term, Jay, across multiple work groups about the need to have even maybe an indigenous kind of focused tool. And I made a point when it comes to the rural issue of urban versus urban, rural versus rural, is not they're not apples and apples, it's apples versus oranges. So should we even be having a tool that's only a national tool that only you can separate, you should be able to separate them out. So you can go in and look at your urban only tracks, go in and look at your rural only tracks, and then the importance of doing that, and then also benefits of having more region specific tools, and being able to have organizations in that region who can act as anchors to help facilitate bringing groups together to address those problems. So it makes it more of a smaller bite to get at.
Absolutely. And I would say that is one thing that all of these screening tools have to recognize, is there is a lot of inconsistency in reporting requirements. And so when we tried to find maternal and child health data, there's some whole states just don't report certain things that you think everybody would report, but they just don't. And the same thing for water data. Water data was one of our biggest challenges. It's just the ability to link to water data is really very sad. And I think they state it's because of emergency, that you want to have national security around that, but it doesn't alleviate the fact that you still can't get robust water data across the U.S. So I think that's really an important exposure that we have to consider is a real issue for many EJ communities across the U.S.
Yeah, the data, the tools are air pollution bias, but the air pollution data is not great. So Jay, I'll just say that. Air pollution bias, but the air pollution data is not great. Go ahead, Jay, if you want to add anything.
I just want to follow up on what we just discussed. I mean, what has been said before, and including the question I'm trying to answer. One of the reasons I stick to the contiguous US, not looking to Alaska and Hawaii, is the even larger margins of error for certain groups. And disability data, I've never looked at disability variables for those areas outside, the 48 states before, and I found massive margins of error. Much larger in Alaska and Hawaii, and I don't know those exact reasons why, but that's one of the reasons I did not want to include that in the analysis I presented here. But that definitely needs to improve also, and I'm sure it's for many other communities, indigenous as well, as I mentioned already.
Okay. Are there any other questions?
No, we do not have any more questions.
Well, y'all colleagues, y'all have any closing thoughts? We got like 3 more minutes. if you have any closing thoughts.
I think that these tools also, in particular, have the real opportunity to be used to dig in for a lot of science questions. Like one of the things that we've been doing with our CBI is we've been looking at the distribution of stroke centers as well as community health centers. And I think that these tools are important because oftentimes, as we see with our tool, they do not align where the salutogenic material, infrastructure needs to be placed. And so I think that what I noticed in the Justice 40 initiative, well, there's not a lot of funding for health-related infrastructure and resources, and that we need to combine what we're seeing in our screening and mapping tools to have the intersection between environment, climate, and health. And that's what's really critical to me. And so when you take a look at our CVI tool, you'll see that you can look at it by EPA region, and those EPA region are also the CDC's public health regions. So I encourage everybody to dig in and think about the overlap between EPA regions and public health regions.
That's an excellent point. That going back to Reverend Barber's point in the keynote, I know some of you may have missed it because some tech issues we're having, but the infrastructure, food infrastructure, transportation infrastructure, housing infrastructure, healthcare infrastructure. How do we, again, make sure that the infrastructure is getting to the folks with the most need? Looks like we have one last question. Maybe, I'm not sure if Jay, you want to take the first since I'll stop talking so much. Go ahead, Jay.
Yeah, I'm happy to answer that because I have discussed in other forums and other sessions, not here today, some of the problems in over-reliance on percentile scores. We have to be aware of, being in a top 20% is a matter of concern. But we also have to look at when it comes to, for example, air pollution, there are certain standards, right? Sometimes, there are a tract or neighborhood could be in a very high percentile, but the national standards or whatever is the level of concern for that particular environmental indicator is not exceeded. So sometimes you have to be aware of that, and that's why I have advocated for more statistically reliable methods like local indicators of spatial association to compare a certain area with others in its vicinity in the same state or in the same area or something like that, and which the current national scale screening tools have not incorporated so far. But I'm hoping they will start doing in the future instead of relying only on percentiles as an indicator of concern. And I'm happy to have the other speakers add to that.
Yeah, I would wholeheartedly agree with that. We see that, a census tract may not be the highest ranking with our overall national score, but that when you dig in and you look locally, it may rank really high for one particular or two particular census tracts. Like, for instance, we have one in our community that ranked in the top 100 across the United States, and it did not rank very high for extreme weather events. It was, in the bottom 2/3. But when you dig in and look at it, flooding was a huge risk in that community. And so being able to dig into those types of things, I think really, really helps you to get that local perspective, which I think Dr. Wilson was, and you rightfully so, are saying that we have to really consider that environmental injustice is something that is very local.
Yep. Thank you. That's all for me. I don't have anything else to add to what's already been said. So I'm not sure we have time to take this last question, Dr. White.
I think we have a few more minutes.
Our tool does include rental, the burden of housing, overall burden of housing, as a percentage of income.
And we've had some really robust discussions, right, Jay, as part of the SCB US EPA EJ Screen Work Group about opportunity costs and energy burden. We talked about energy burden, and we did have a discussion about what would be the best housing indicator to include. And so I think we recommended percent rentals, home ownership. And I thought it was some really good discussion, Jay. I'm not sure where it landed, but I thought some discussion came up about
both
adjustment.
Both EJ Screen and CGIST use poverty indicators, person below federal or twice below poverty level, which can be problematic for across the country comparisons. Don't take out for regional and geographic differences. And obviously we need to look beyond poverty rates as a federal poverty level as the threshold for determining issues of class and wealth, right, which can be much more complicated than that.
Yes, I think there's been discussions about other indicators like per capita income, median household income. There are a few others, even as it relates to not answering your question, but very low income folks. So if you think about that group of people who are most vulnerable, right, economically vulnerable, which may mean they have some other kind of they may have some other associated risks,
right,
keying in on those populations too.
Yeah, below area median income is a more localized measure that could be useful. That's used by housing and urban development, right? So,
yep. So,
and our CDI tool also has percent of HUD funding, as well as the whether or not there is HUD public housing in the census tract as well. But I think one thing to be cognizant of is it's at a census tract level scale as our lowest geographic resolution. And that's because, there's a lot of uncertainty when you go lower that I think you have to recognize. And for some, the county level is too much, but a census tract is like, 4,000 people. So that's a lot. And it's very, it's a wide generalization.
Okay.
All right. Well, thank you so much to all of our speakers. Thank you to all of our viewers today. And I think we are good to close the session.
Cool. Thanks, everybody.
Thank you for having
Thank
us.
you. Bye-bye.
Thanks,
Bye.
Greg. Thanks, Jake.
Thank you.
Thanks, Grace. Gotta take care. Thanks.
Good to see you. Bye.
You too. Thanks, Dr. White.
Thank you.
Yeah, you're welcome.